Awesome. Well, thank you. I see a bunch of people joining, so thank you for joining our webinar. We're going to hold off for a couple of minutes while we wait for the rest of the people to join. In the meantime, you get to stare at the faces of Jordan and I. We are the co-managers of 1501 Health, and we are so excited to have you join us this morning. As we wait, we figured we would just talk a little bit about our favorite experiences in launching 1501 Health. Jordan, we did this back and forth when we led the info sessions a while ago. That was a lot of fun. What else stood out to you in the selection and application process with 1501?
Well, first off, I hope we've cleaned up our stand-up act. It took a lot of iterations, but no, I think what impressed me the most was just the quality of the sheer number of applicants, and on top of that, I think the founders were just incredibly impressive. Really interesting backgrounds, incredible resumes. Wish we could bring them all in, and then. Another fun part was all these applications we got from across the globe, and I thought a lot about what it would be like trying to coordinate meetings with the group in Australia. But here we are. What about you?
Yeah, I mean, I think reading the applications was a lot of fun. I have like a love-hate remembrance of our like office hours, right, where we would have just like 15-minute slots back to back for hours talking to people, which was, exhausting in some ways, but also just so much fun because we got to meet so many interesting people. And yeah, talking to all of these amazing innovators was such a great part of the 1501 Health process.
Just a tremendous amount of out there and what's being offered. So it was a really enjoyable experience.
Absolutely. Absolutely. And I see that it is now 9:03, which was our cutoff point. So Jordan, what do you think? Should I get us started?
I think we should do it. Let's go.
Let's do it. Awesome. Well, thank you all for joining us this beautiful Wednesday morning and listening to Jordan and I chat as we waited for a few more people to join. To quickly introduce ourselves, I'm Emily Durfee. I'm one of the co-managers of 1501 Health, and I'm part of the Healthworx team, which is the innovation and investment arm of CareFirst.
And I'm Jordan Evans, the co-manager of 1501 Health from LifeBridge Health.
Awesome. And we are so excited to launch 1501 Health today. It has been a journey, and we are so grateful that each of you guys are here to celebrate with us as we welcome our first cohort. So to get the party started, I'm proud to introduce Neil Meltzer, the CEO of LifeBridge Health, and Brian Pinnock, the CEO of CareFirst. They share a vision on how we can support healthcare innovators, and they're excited to get the party started. So Neil, over to you. And Neil, I think you might be on mute.
Yes, I was. Well, thank you, Emily. I'm so excited to be here today as we launch 1501 Health and announce the first group of companies who will join this new and dynamic incubator program. Today's really a wonderful beginning to an exciting journey. Today, we come together to celebrate this new beginning and the promise of new possibilities through our partnership and collaboration. Our teams from the LifeBridge Health Innovation Department and Healthworx have been working hard to ensure our first cohort of companies will have a strong foundation and a path to lead them to a brighter future. We appreciate all that the teams have done to get us to where we are today. There's an African proverb that I find particularly resonant for this moment. I've shared it so often that some people on my team suggest that I really need to retire it. However, I think it's worth bringing out of retirement for this momentous occasion. The proverb says, if you want to go fast, go alone. If you want to go far, go together. As we welcome our first group of companies to 1501 Health and begin our journey together, I know that our collaboration will take us far as we work together to develop groundbreaking technologies and innovative approaches to advance healthcare. We do not take this journey for ourselves, but for the promise to improve the health of the people in our communities. And as we take these first steps today, it's my pleasure to introduce my friend and one of our partners in this journey, CareFirst CEO, Brian Pinnock. Brian?
Good morning, Neil. It's great to see you, and it's fabulous to be here in this culmination of a lot of work and effort that's gone into this and the partnership and the relationship more broadly with LifeBridge. I do regret, I will say, I do regret the fact that we're not in person today and that you and I aren't standing shoulder to shoulder for this ribbon cutting. And looking forward to getting back to that at some point. But appreciate the partnership, Neil. Appreciate your friendship, all of the amazing work that you and your organization are doing in the local community, specifically over the course of this past year through the pandemic. And how you just continue to step up and step into the challenge to ensure that we cared for the people of our communities, our shared communities, not just in the work that we do through innovation, but even more broadly than that. So looking forward to that day when you and I can be together again and continue to have those conversations and to innovate around this relationship. I'm incredibly excited to be here for the launch of 1501 Health. This is a shared vision and has been years in the making at this point. We know that healthcare is a complex and highly regulated industry in need of many changes. That was a binding force that brought the two organizations together. And we know that access to affordable healthcare can be hard for people to navigate. That this is a truism that continues, unfortunately, in the trajectory of healthcare and something where there's incredible responsibility and opportunity. It's also a difficult environment for entrepreneurs who are seeking to step up and to design solutions that make healthcare better. It can be a challenging world to navigate, not just access to capital, but obviously having access to the information and the partnership and investment that you need to ensure that these great ideas turn into incredible solutions. And so enter 1501 Health. This venture demonstrates our commitment to create an ecosystem for the change that's necessary through a coordinated and collective effort from major stakeholders, including payers and providers and entrepreneurs. It's a dynamic partnership we began in 2019, so thrilled to be here today with you in 2021. Both CareFirst and LifeBridge Health are committed to supporting early stage healthcare companies through investment and incubation programs, creating space for them to live within the provider and payer environments, having that inside perspective in view, and taking advantage of the knowledge and connection we share with the members and communities we serve, actually ensuring that there's that close connectivity and understanding and relationship to make sure that as we design and innovate, we do so through the lens of the people whose lives we intend to impact. This launch creates that space to support the success of startups working to elevate the patient experience, improve access to healthcare, and most importantly, to improve the health outcomes of individuals, of the whole persons whose lives we seek to touch. We are committed to the role we will play to set up startups by creating an environment to spark innovation through collaboration and access to our collective resources. We can lend our expertise to these bright, driven entrepreneurs as they design meaningful solutions and work to integrate them into the healthcare space to create scalable impact. It's that relationship between what we know and where we've been and where we intend to be that I think makes this an incredible opportunity. 1501 Health will provide both financial support and structured mentorship to these promising startup companies. And so we're looking forward to this first cohort. We're excited to see the power of community through this program. We officially start next week, but collaboration is already underway with momentum building each and every day. We believe the combination of intentional capital investments, strategic guidance, and thoughtful network will propel these solutions into the market, and we can't wait to see all we'll accomplish together in the coming year. I want to thank you for joining us for this virtual launch. Hopefully, we'll be together in person soon. This launch is an exciting milestone and holds the promise of major stepping stones to transform and innovate the future of healthcare. Before we make the announcement about the companies joining the cohort, I know there were a few guests who sent us video messages, so let's hear from them now and really the attention that we're gathering all across the region and the state in support of this concept as we move forward. So enjoy the celebration. Thank you so much for being here.
Hello, everyone. I'm Daniel Blum, President of Sinai Hospital and Grace Medical Center and Senior Vice President of LifeBridge Health. I'm elated that we are officially kicking off the inauguration of 1501 Health today. After years of working together with our partners at Healthworx and CareFirst, we have our first cohort of healthcare startups. I truly enjoyed sitting in on the panel that reviewed our applicant participants and listening to each of their pitches. Each and every company was a winner in their own way. I learned so much about the future of healthcare. As we take these next steps in our partnership with Healthworx and our first 1501 Health cohort of companies, I'm eager to see how we can work together to advance healthcare and the health of people in the communities that we serve. This is just the beginning of great things to come, and I can't wait to see how you bring innovation and access to Baltimore and the surrounding areas. Welcome to 1501 Health. We look forward to working with you.
Hey, this is Mayor Brandon Scott. I am excited to join you for a virtual ribbon cutting for 1501 Health. 1501 Health is a program customized to support early stage healthcare companies. A program like this is needed now more than ever. We know that COVID-19 has wreaked havoc on our communities, and I am glad to know that programs like 1501 Health are ready and willing to support those who support our residents. I look forward to seeing the positive impact this will have on our communities as we not only continue to weather this global pandemic, but also reimagine what public health looks like in Baltimore. Again, welcome and congratulations.
Hello, I'm Maryland Commerce Secretary Kelly Schultz, and I'm delighted to help celebrate the launch of 1501 Health. Some of Maryland's greatest strengths lie in our healthcare and innovation sectors. We have great assets like our hospitals, health systems, and universities, and our business community is fertile ground for exciting and daring new ideas to grow and to thrive. As a result, 1501 Health is an example of what we do best here in Maryland. And I'm thrilled to see that great ideas and bold advancements that this first cohort produces. And after this past year, we know that supporting this kind of innovation is more important now than ever. So on behalf of the state of Maryland, thank you and congratulations to LifeBridge Health, to Healthworx, to the 5 startup companies, and to all of the partners and supporters of this wonderful initiative. Keep up the great work.
Good morning. I want to thank LifeBridge Health and Healthworx for their gracious invitation to say a few words today. I want to personally offer a very well-deserved congratulations to the 1501 inaugural cohort. As the former Health Innovation Officer at a software company, Fearless Solutions, here in Baltimore City, and the Commissioner of Health for Baltimore City, I am literally geeked about the work that is going to take place at 1501. You should be so proud of your accomplishment. I'm very excited to see the way that you will drive change and innovation here in healthcare. I look forward to seeing how mentorship and resources interact to increase healthcare access and foster community development right here in Baltimore City. Good luck on the next part of your journey. I can't wait to see all that you will do.
Greetings, Delegate Marla Embry here to extend a congratulations to Healthworx and LifeBridge Health for the launch of 1501 Health. I'm so excited about this incubator and all the companies it's going to be able to support who are doing awesome work in the healthcare industry. Here at the General Assembly, we've been working very hard to ensure that we expand the access of healthcare to everyone, including our most vulnerable communities. Helping the most vulnerable communities is what we should be focused on. And I'm so excited that with 1501 Health, we can support companies that are doing just that. Again, congratulations to 1501 Health, Healthworx, and LifeBridge Health. I cannot wait to come visit the facility soon.
Thank you, Neil, Brian, and Dan, and all the elected officials for their warm wishes as we launch this program today. My name is Dr. Dan Duran. I'm the Chief Innovation Officer and Chair of Radiology with LifeBridge Health. On behalf of the innovation team at LifeBridge, I'm thrilled at the way our partnership with CareFirst and Healthworx has blossomed and enabled us to help these incredible companies through their journey into bringing pioneering care and access to patients everywhere. I'd like to congratulate all of the founders who applied and showed interest in our program. I had the pleasure of learning about many of you and getting to know you a bit, and I'm so impressed with all you've achieved to get to this point. This past year has taught us that there's an endless need for new and groundbreaking technologies. And I encourage you all to stay the course and believe in yourselves and your companies as much as we do. I'm also grateful to Emily and Jordan, who've been working tirelessly with leaders at CareFirst and LifeBridge with these startup applicants to find entrepreneurs who are truly changing healthcare. We are eager to announce the first cohort of companies, and I hope that you'll join me in congratulating them. We can't wait to see what they'll achieve for healthcare and for Baltimore. Thank you.
Thanks so much, Dan, for that introduction. As you said, we were blown away by the quality and quantity of the startups that applied for 1501 Health, and it was a really difficult task narrowing down those applicants to these 5 companies, but we are so proud to have these 5 companies in our inaugural cohort. So without further ado, I'm going to pass it over to Jordan to start the introduction.
All right. Thank you, Emily. I'm really excited to do this. So let's start. LifeChair Health of Columbia, Maryland builds networks of clinical and non-clinical resources and offers a range of services to address minority health disparities. Combining high-touch encouragement from their trusted hair professionals and digital tools, LifeChair Health initiates client discussions about chronic health issues that disproportionately affect minority communities.
Awesome. We're also excited to welcome Even Health, which is a mental wellness company and the creator of Cabana, the first digital counseling platform offering anonymous group support that is facilitated by licensed professionals and leverages a variety of devices, including virtual reality. Even Health is focused on high stigma populations, including healthcare providers and first responders. We can't wait to see how Heather and David combine new technologies to support mental health even within healthcare.
Next, we'd like to invite Baby Live Advice of Calabasas, California. Baby Live Advice is working to reduce costly complications and close gaps in maternal and infant care by using tech-enabled professional providers in collaboration with health organizations, employers, and insurers to provide remote education, monitoring, and support to expectant mothers and new parents.
We're also excited to welcome Pair Team, which is the first end-to-end provider enablement solution for Medicaid, providing a wraparound technology, care team, and EMR embedded support tools to coordinate patient care and automate value-based care operations. Neil and Kathy have had impressive results in their initial pilots, and we believe that their work is going to dramatically improve the quality of care, especially for some of our most underserved populations.
And last but not least, WellSet from Venice, California. WellSet is the premier centralized platform connecting the holistic wellness industry. Users can find and book thousands of individual and group sessions with specialists in 30+ modalities, including acupuncture, health coaching, holistic therapy, Ayurveda, and more.
Awesome. Great. Well, I would love to now invite the members of the inaugural 1501 Health cohort to turn on their videos. Awesome. Welcome, guys. Congratulations. As Jordan and I have said, and the rest of our teams have said, we are so excited to have each of you with us. We cannot wait to support you in your journey by connecting you to resources and expertise that you'll need to be able to integrate and scale your work into healthcare. We think you guys are going to change the way that health works, and we are excited to be part of that journey. And so next, we are excited to cut the ribbon for 1501 Health officially. Brian's ready, he's got his ribbon. If everyone else can bring up their ribbons, and if we can welcome the rest of our ribbon cutting panel. The people that you see on your screen are those across CareFirst, Healthworx, and LifeBridge who have been part of the 1501 Health journey and have helped us get us to this point of launch. Those with the rainbow backgrounds are our first cohort, and we are so excited to see them. So does everyone have their ribbon? Yeah, awesome. And your scissors? Let's cut this thing on the count of 3. 3, 2, 1, cut. Awesome. Guys, we are so excited to launch 1501. We are so grateful to each of your support and so excited for this first cohort. And from here, I'm going to turn it over to Jordan to introduce our keynote speaker. Thank you all for joining and helping us celebrate.
Thanks, Emily. So next, I'm excited to introduce Kevin Dedner of Hurdle, the CEO of Hurdle. Kevin's journey to CEO is one that has personal and professional significance to him. His vision for Hurdle was to create culturally intentional mental health care, and after several years of pitching his idea to investors and health leaders, he gained momentum at a time when our nation was amid a pandemic and calling for racial justice. Hurdle's promise is to help people show up whole, operate with joy, and live with power. Kevin is excited to share a bit about his startup journey and why programs like 1501 Health can make a difference to startups as they integrate into the healthcare system. Take it away, Kevin.
Great. Good morning. Jordan, can you hear me okay?
We can hear you, Kevin. Thank you.
Great. Well, first of all, let me just do a bit of housekeeping and thank Jordan and Emily for their work in pulling together today and for moderating this time that we've had together already. I also want to thank the leaders at LifeBridge and CareFirst. And most importantly, I want to congratulate all of the founders today on being accepted into the program. I took a look at the descriptions of the companies: Live Chair, Even Health, Baby Live Advice, Parateam, Well Set. And I am really impressed with the missions of your company and the progress that you've made to date. I really enjoy the opportunity to share my journey particularly with other founders, because I think that oftentimes founders are not as honest as they should be about what it really takes to build your company, what it takes to get your idea off the ground. And as Jordan alluded to, my experience was a collision of my personal experience as well as my professional experience. And so if you'll indulge me, I'll share a bit of my story with you all. I started my career working in public health, and several years ago, I had a pretty successful public health consulting practice, but the work became very stressful and very overwhelming. And before I knew it, I had worked myself into mental exhaustion. And my mental exhaustion actually led to a period of depression. And I ultimately saw 3 therapists before I could find a therapist who I could connect with. And I have to tell you that was a really difficult time and a difficult period for me. As someone who typically has it all together, it was hard to even convince people that I was having a tough time. But I eventually found a therapist, Dr. Tony Spann, and Tony eventually came to work at our company as our first chief clinical officer. And after my recovery with Tony, I was asked this question: had I ever considered doing anything in digital health? And in that moment, literally in that moment, it was October 24th of 2017, my company was born. And I have to tell you, I think your journey, all of you all are on journeys that will unfold very differently. But I think the important question that every founder should be speaking to every day when they wake up is, why me and why now? That question was actually given to me by one of the leaders from Morgan Stanley, Carla. Some of you may know her. And that question drives me every day. Why me? Why now? As founders, you've been given an idea. And I really see a founder as a steward of an idea. And what's going to happen is people are going to tell you the idea won't work. Some people will believe in the idea. Some people will just think that you're totally on the wrong road. But you have to be a steward of the idea. You have to know for certain that you're solving a problem that only you have the answer to. Again, why me? Why now? The second thing I want to stress that's super important is everybody's going to tell you how you should do it, how you should pitch, what your elevator speech should look like. And at the end of the day, you have to find the style that is most comfortable for you. There are going to be 1,000 ways to build your pitch deck. There's 1,000 ways to give your elevator speech, but you have to figure out your own delivery style. You can't show up and present like the next person. You have to develop your own style. And the final point that I think is really important that we don't hear or talk a lot about as founders is the discipline that it takes. When I think back about the years where I was pitching and telling my story, I wrote about this a few days ago. It felt like I was literally hollering into a black hole and no one was believing me. And I had to develop like this discipline, a discipline of hearing no and not losing doubt in myself, a discipline of getting up every morning and working like my life depended on this idea, even when things were not working out, because I believed in the idea and I knew that I was the steward. And so this discipline is something that if you don't have it, I'm afraid you won't make it. The truth is that there's a lot of investment right now in telehealth companies. And while, we're fortunate at Hurdle that we have received our initial series funding, the truth is it's a very competitive market. And all of you are solving problems that need to be solved, but there's someone else who's getting up every morning trying to solve the same problem that you're trying to solve. And they're talking to the same investors and so forth. So the discipline is super important. I just want to say, when I think about being accepted into programs like this, I think about my own journey. And I actually thought about this morning before the event. I participated in 5 programs somewhat similar to this. And each of those programs came at an incredibly important time. The first, because they gave validation to the idea. And your idea now has been validated by 1501. It's been validated by CareFirst and LifeBridge. That validation is super important. But these programs, each program, you will take something from that becomes a part of your delivery, of your style, your ecosystem indefinitely. For every program that I participated in, I took something. And now those program leaders, the founders, the funders of those programs are in my trusted circle of advisors. So this opportunity should not be taken for granted. The curriculum may be intense, but it will be worth the patience of working through it because you'll be able to grab the things that you need. I wish I could tell you that this will be easy, that securing the funding, building your product will be easy. The truth is it's not easy. If it were easy, everyone would be doing it. And then the other secret I'll let you in on is that when you do cross over and raise a significant amount of cash, you get a whole new set of challenges that you have to solve. And making those tech payments or making payroll become like the smallest things that you're worried about. You get more focused on HIPAA compliance and your product, et cetera, and managing people. So this isn't easy, but if you believe in your idea, you have to wake up every morning and work at your idea like your life depends on it. All of you all have very altruistic companies. And so as I close, I want to share a passage from a book that I often draw from. It's called Good Business. And I draw from this, maybe about twice a month in the mornings in my meditative time. So here's the passage I want to share with you all. Caring can never be a strategy. It must be real and from the heart, because people can detect a phony a mile and a half away. If you don't feel it, don't do it, because you're wasting your time and theirs. So again, I want to congratulate the founders. I am here. Consider me a part of your ecosystem. I will make time to talk to you and give you advice and share the lessons that I've learned along the way. So again, Emily and Jordan, thank you for the opportunity to share. And I wish everyone well.
Kevin, thank you so much for sharing your story and your message with this cohort. I think everyone listening can take your advice to heart. So thank you. That was fantastic. I'm looking forward now to hearing more from our cohort about their own journey building their companies. And to facilitate this conversation, I'd like to introduce Pothik Chatterjee, the LifeBridge Health Executive Director of Research and Innovation. As he facilitates the conversation, if you have any questions for the startups, feel free to drop them in our chat. And if we have time to get to them, we will. Otherwise, we'll post answers online. Take it away, Poteek. Thank you.
Thank you, Jordan, and thank you, Kevin, for those wonderful keynote speaker remarks. Your point about caring being authentic really resonates with us at LifeBridge Health, where our motto is care bravely, and with CareFirst as well. It's in the name of our organizations and our missions. So thank you for sharing your message with our audience and our startups today. Thank you to everyone for joining us to celebrate the launch of 1501 Health. Now that the ribbon has been cut, it's official. I am so proud to be an executive sponsor of 1501 Health and to collaborate with the 5 startups that you see in front of you today. When we first started developing the idea for an innovation center with LifeBridge Health and CareFirst 3 years ago here in Baltimore, we could never have foreseen what lay ahead. A global pandemic and dramatic changes in how we live our lives, our growing reliance on digital tech to connect and deliver healthcare, leveraging telemedicine, mobile apps, online scheduling, and digital waiting rooms. Historic moments such as the one we're currently living through call for a drastically new approach to healthcare. We need creative collaborations between leading institutions and dynamic startups. And we need to keep our health equity lens as we engage in sustainable efforts to provide care and access to all members of our community, especially our vulnerable populations. We should design the health technology of the future in ways that reduce the digital divide, starting now. The 5 startups we have selected for 1501 Health represent the best and brightest in our view to meet those audacious goals, and with the teams and talent to create a lasting impact in our healthcare industry and society at large. Our 5 startups span across the social determinants of health space, mental health for high-risk, high-stigma populations, maternal health coaching and support, a digital front door for primary care, and a wellness practitioners marketplace. Are you ready to meet these movers and shakers? Let's welcome our first ever cohort of 1501 Health. We'll start with Baby Live advice. As Jordan mentioned, for our audience today, you can put questions in the chat box. We would love to make this as interactive as possible and hear from you. So Baby Live advice, Siggy, congratulations.
Hi, thank you so much. We're so thankful to be here, really are. Thank you.
Thank you for joining us from the West Coast. So tell us, how is your startup making an impact on maternal health outcomes for diverse populations? And what are your goals for 1501 Health?
Well, thank you, Daniel, and the whole team. So for us personally, you know, the maternal child crisis in our country has been very sad to watch and be a part of. I've been part of it since 2014, looking for different solutions. And truly was thinking that the best way to reach a mom or a baby is by serving with the people that she trusts the most. And who do we trust the most? Nurses. So put together technology and nursing and set up to support moms through telehealth and telemonitoring and teleeducation to empower them to do the right thing for themselves and for the babies. Obviously, from day one, Baby Live Advice was really looking at the lower socioeconomic moms who are at the margins of our society, to help them to come together and get the best kind of care that they can, working with Kaiser or originally, and then later on with others, to look at all moms, regardless of race, ethnicity, and location. And we are so excited to join you guys here today in that mission. Thank you.
Thank you. Anything else you want to mention about your goals and hopes for the coming year with 1501 Health?
Yeah, so actually today I'm allowed to announce that we signed a contract with Emory in Georgia, and where we'll be taking care of African-American moms from preconception to early childhood. So we are allowed to say that here today, so that's a big announcement. But with you guys, we're looking again to bring in health into Baltimore and the DC and other areas where mom needs our help, and really hope to reduce the morbidity and mortality, especially in the African-American community, and again, in the rural communities where we can help the most with telehealth. The joint of provider payer is very exciting to us. It's where we feel that we need to make the most impact, and hope to get both of us together to look at those marginalized communities and how we're gonna help them in the future.
Great. Thank you very much, Siggy.
Thank you. Thank you so much for your time. Thank you.
We're going to shift to our second startup, Even Health. Mental health has become a major concern in our society with the pandemic and burnout, particularly with healthcare workers on the front lines. According to the Washington Post, 60% of healthcare workers say stress from the pandemic has harmed their mental health. How does Even Health fit in?
Thank you so much. We are thrilled to be here. Heather and I couldn't be more honored and blessed to have this partnership. We actually got our start with the military community. So we've been working with the Air Force for the past year, and there are tremendous similarities between what I call our everyday heroes. So the men and women who serve us, from whether it's military, whether it's the frontline staff, whether it's even first responders. The reality for our healthcare community is that we've been in a combat zone, so to speak, over the past year. This is one of the first times where if you're a caregiver used to taking care of folks who are in danger or at harm, you're actually doing that, putting yourself at danger and harm. And combat medics are trained for that. Our training for our healthcare workers, orthopedic surgeons aren't used to losing patients. And yet they're in the front lines chipping in. And so these are real stressors that are being faced across our healthcare communities, and past pandemics have proven that those stressors have implications. So what we're focused on is just creating a space that engages people in that conversation sooner, so we can stem what we know from past efforts have been really serious issues, from the highest risk down to just burnout and fatigue and folks changing careers. So our focus is, how do we create a safe space to engage people sooner in conversations about mental and emotional health challenges before it becomes much more of a crisis.
I find your mission so admirable to reduce stigma in populations that truly need the mental health support. Tell us a bit about how you're using virtual reality to create that group therapy type of environment.
Yep. There are always silver linings in issues like COVID, and while nobody wants to be on another virtual call, we've jumped in and we make the most of that. I think we're at an inflection point in the sophistication of the average end user and how we engage virtually. And we have an opportunity with virtual reality. It's the empathy medium of our time, where we can create another environment of how we actually connect and have spatial communication for individuals. So moving beyond the Hollywood squares, which I think is really version 1 of virtual communication, to create an engaging space where individuals feel that they're in the same space. And we know that when people feel that they're in the same locations, they collaborate better and they coordinate better. So we are really using the technology to create an environment that's conducive to a conversation, but we're also leveraging the fact that these are difficult conversations, and there are real barriers and risks to talking about anything mental and emotional. And so we want to give individuals the control over what stays private, what doesn't. And in some cases, turning your camera off creates that level of privacy and comfort, but it needs to be done in an environment that doesn't just feel like you're looking at a black box. So we're leaning into that. We're skating towards the puck in terms of everyone having a VR headset. And so we're fairly practical. Everything works on a smartphone or on a laptop, but we know that the future of virtual communication is headed in a direction, and we're building towards that.
Great. Well, congratulations again to Even Health. Congratulations to David and the team. And it's great to have some local representation. Even Health is based out of Annapolis, Maryland. So congratulations to the team.
Thank you. We're looking forward to it.
Moving on to startup number 3, LifeChair. Andrew, congratulations to you and the LifeChair team. I have to say, you have one of the most unique ideas that I've ever heard of in the healthcare startup world, leveraging the barbershop setting and the trusted relationship between the barber and Black men to introduce a conversation around healthcare education and prevention. Tell us more.
Yeah, so Andrew Suggs, co-founder and CEO of LifeChair Health. I originally started this business not in healthcare. We were a scheduling and booking and payment processing tool primarily for minority barbers. And then unfortunately, my dad's health was declining as our business was growing. And that led me to research health disparities. And so unfortunately, just for the sake of time, he passed away last year from congestive heart failure. So one of the things that we're focused on is reaching, accessing, and engaging men and women who look like my father before they have a shortened and terrible quality of life, right? And so really, our focus is to reduce health disparities by offering screenings and recommending coordinated next steps in clients' healthcare journey based on health risk assessment data, and then making healthcare more accessible, for racial minorities that have been under-engaged. And so we have an incredible opportunity to access a very captivated audience at the barbershop and now hair salons, because we have made a foray into the hair salons, and also looking at other community settings that have trust, like churches as well, so that we can really scale and grow this business and make it ubiquitous and sustainable.
That's great, Andrew. Thank you for the context and the personal history with how you came up with LifeChair. I know this past weekend, there was a very exciting event combining LifeChair and the LifeBridge Health mobile clinic. Can you tell us a little bit more about that and how your experience was?
Yeah, it's great. So we, through one of our partnering barbershop, actually the owner was very adamant about offering the vaccine at the barbershop, because this is it's a very tough zip code if you look at where that shop is located. And so we were able to, through the partnership with LifeBridge Health, bring the mobile clinic right in front of the shop and get about 50 vaccines executed. And that's all we had that day, right? So I'm sure if we had more, we could have gotten more people vaccinated. But now with this partnership, we're going to come back in 30 days to offer the second shot for all those that got vaccinated. In addition, just beyond COVID, just giving people access to health resources, taking blood pressure readings, right? Because one of the things we all know in healthcare is hypertension is a silent killer. And most people know the next time they're going to get their hair service, but they don't know their blood pressure numbers. And so we try to really close that gap in knowing blood pressure specifically, because it's the catalyst for so many other conditions. And being able to provide the physical resources, and with the development of our product, we're going to be able to take a more of a digital approach in the coming months as well.
It also strikes me that there might be a major opportunity in the female market with salons. And have you thought about expanding into that area?
Absolutely. So within the last couple of months, we onboarded about 5 salons. Now the economics and the engagement is a little bit differently, because what we found out is that those services are a lot longer than the men's services. So compare a 2-hour service versus a 30-minute service. But the great thing about making an entry into the female market is that typically if they have children, so now we get access to the children as well. I'm not saying that that's not true in the male market, but I think it's more true maybe in the female market. But then also we believe that the females and the spouses and partners give us access to do great things with the men as well. And so basically what we're doing is capturing and engaging an entire family, making this entry into the next adjacent market.
Great. Well, lots of great things to come. Congratulations to you, Andrew, and the LifeChair team. Moving on to our 4th startup, which is Pair Team. Congratulations to you both on the Pair Team side. So you call yourselves the digital front door for primary care. Can you tell us about how your technology platform helps practices improve outcomes and control costs?
Yeah, of course. It's a pleasure to be here, everyone. Thank you again so much for accepting us into this first inaugural cohort. Cassie Choi, a registered nurse and my wonderful co-founder here who is on the call, met on the ground floor building tech-enabled primary care clinics. We saw in our experience that a lot of the work that was traditionally performed in a clinic can be done off-site. Think patient engagement and outreach, scheduling, visit preparation, care coordination, chronic care management, all of the follow-up that goes on in healthcare where people get lost can all be done remotely. And what we found is that this model of operational innovation has largely ignored the Medicaid clinics and their populations. these are physicians where their hearts are in the right place, but they're burning out 50 visits per day, 7 minutes per visit. And so what we provide is the remote care teams, the offsite teams, and wraparound operational technology to scale these clinics to provide care into their underserved communities and ultimately reduce health inequity, well, promote health equity in these communities. We do a combination of automation, things like robotic process automation for these clinics, text email-based outreach, so that these patients can contact us any time of day, and it looks to them like we are part of the clinic in their local community.
Thank you for that background. That's really exciting. We have seen the power of automation at LifeBridge Health and the ability to scale technology very effectively. I want to ask you, what does it mean to you to be part of an incubator with both a health system involved and health insurance? Since you all have been through a incubator program before, what does 1501 Health provide to you that's different? What are your hopes and goals with us?
Yeah, you nailed it. The idea that of working directly with clinicians on the LifeBridge side and the folks that understand the kind of, the costs involved with all of it. Everyone wants really high quality care and we want to provide it, but there are fundamental costs involved and you really have to understand where those trade-offs come into play. Using the experience, the data, and just the expert panel that 1501 has introduced us to in the LifeBridge and CareFirst side, we hope to address these questions more effectively for our patients in these communities.
Great. Thank you again, Neil and Cassie, and congratulations. We're so excited to work with you over the upcoming year.
Thank you.
All right. So last but not least, startup number 5, WellSet. So yoga, acupuncture, Ayurveda, nutrition coaching, life coaching, these terms have become mainstream in the United States in a way that really wasn't the case 20 or 30 years ago. And the health benefits are also starting to become more widely recognized in our society. So what is WellSet and what are your goals with 1501 Health?
Thank you so much. And thank you so much to the entire 1501 team. This has just been already so inspiring. I'm so excited to be involved. And WellSet, our whole team is very excited. So WellSet is really, we created WellSet because we believe that holistic healthcare should be accessible to everyone. And through our personal experiences, we realized that it can just be really hard to figure out the path down preventative health and well-being, especially if you're in an acute need state and feeling really sick. So we created WellSet to help people find the right practitioners to serve them, and then also to help the practitioners really run their practice. Because what we realized is that people were having to go to, when I started down this journey, it was about 8 years ago, which was before the whole movement of wellness and yoga being in everybody's house and on everybody's street. But I was having to go to a co-op and look on the bulletin board to find an acupuncturist. There's no place to figure out how to find a holistic provider. So it's a little bit better now, but there still is no real centralized place other than WellSet to find a trusted provider. So we list practitioners in over 30 different modalities. You named a few of them. And we also help practitioners run their businesses. So we help them transact, we help them take payments, we help them facilitate one-on-one sessions, and we also facilitate group sessions. We've had over 10,000 practitioners list their practices on WellSet since the beginning of last year. And we've facilitated over 60,000 group and one-on-one bookings since we launched in the middle of COVID last summer. So we've been having a lot of success, and we're really, really excited about the next phase of our company. We just actually acqui-hired 2 companies, which I am announcing today for the first time ever. And so we're excited to expand our team and also really dig into all of the things that we're going to be looking into with 1501, which I can also go into if you want.
Congratulations on the acqui-hire of these 2 companies. Tell us more about how that extends WellSet's services.
Yeah, so we're really, one of the things that we realized is that the price point for one-on-one sessions is really too high for most people. Since a lot of these sessions are being paid for out of pocket, it means that people are having to pay for $100, $200 per hour kinds of sessions with these incredible specialists who just aren't covered by their insurance. And that really limits care for people. And that's just not how the system should work. Everyone should have access to these types of providers and should understand how to get in touch with them. So we've been exploring different ways to solve that problem. Obviously, we're really excited to be in 1501 because we want to expand coverage of these different types of practices, and also ways for different corporate wellness programs and self-insured plans to begin, and NFSAs and HSAs and HRAs to all begin to cover a little bit more of these practices. But another thing that we're really excited about is the group session space. So we're seeing a lot of people who would maybe not be able to afford a one-on-one session going to group sessions on a weekly or monthly basis and getting a lot of value from them. So one of the companies that we're acquiring and bringing in-house is allowing us to, day one, move beyond the one-on-one session and host these group classes and actually events and courses and retreats as well. So it really expands our technical offering.
That's so exciting. Congratulations, Tegan, and to the WellSet team.
Thank you.
I really get excited about are the synergies between the different companies in our 1501 Health cohort. Even Health is also in the mental health space and looking at group therapy. We talked to Neil earlier about his and Cassie's experience in automation and tech platform and the lessons that could be shared with other startups in our cohort. So really excited to get this ecosystem going, and congratulations. We're so looking forward to working with you and all 5 of our startups over the coming year. So thank you again, everyone, for joining us today, and congratulations to our 1501 Health startups. I hope that next year we can celebrate with all of you in person here in Baltimore, but it was an absolute pleasure with celebrating with all 200 plus of you today virtually. Thank you, and back to you, Emily and Jordan.
Thank you so much, Protik, for hosting that really interesting conversation and for helping us get to know our first cohort better. I actually would like to invite all of our cohort members who are here to join us on video as we wrap up, simply because fundamentally today is about you, and I would love to see your faces at the end of this conversation. I want to thank all of you guys for applying and being part of the first 1501 Health cohort. I think we're going to do amazing things together. I'm excited to leverage the resources at LifeBridge Health, Healthworx, CareFirst to support your endeavors. I'm excited to watch you guys support each other. It's already fun in the chat to see you talking to each other about ways that you want to engage and support. And I just see so many opportunities based on the large ecosystem that we have here for this to make a really big dent in changing healthcare. So thank you all, especially those on the West Coast, for waking up very early to be a part of this event. Thank you for being part of 1501 Health. To everyone who is listening from your computers elsewhere, thank you for joining us and learning about these amazing companies. If you want to be involved in 1501 Health, look us up and get in touch at 1501health.com. As everyone has said, including Kevin, right? It takes an ecosystem, it takes a community. And so, anyone who wants to be involved in supporting these amazing entrepreneurs, please reach out and we'll help you plug in effectively. And thank you to the CareFirst, Healthworx, and LifeBridge Health teams who are able to join us today and who have been so instrumental in us launching this program. So that concludes our launch party. We are so incredibly excited to just be getting started with this process. And thank you all for joining. I'm going to just clap because I'm so excited to see you guys. And thank you all for joining, and enjoy the rest of your Wednesday.
You guys are incredible. Thank you so much. Thank you so much. You guys are incredible.